name is Natalie Clifton, and I'm going to be explaining the process of brain perfusion examinations in the CT department. The purpose of a brain perfusion is to examine the brain's blood flow. These scans are very important in radiology because they provide detailed information about the delivery of blood to the brain and also which areas of the brain are adequately supplied with blood. This test is non-invasive and will help the physician diagnose and treat medical conditions. There are only a few responsibilities for the patient during this exam. First, you should remain very still. It is important to remain still during a brain perfusion scan because any small movement of the head can hinder the results of the scan. Motion artifacts can also be created and may cover up pathology. You should also listen very closely to the technologist. They will be the ones performing this examination and will need your full attention and cooperation. The technologist will also be able to answer any questions you may have. They will also be asking you a series of questions pertaining to your medical history, and it is important that you answer these fully and truthfully. This will also help the physician with diagnosis. During this exam, you will also be given IV contrast. An IV will be started by the technologist, and the contrast will be given at a certain time during the exam. For brain perfusion examinations, the patient does not need to do much to prepare. Comfortable clothing should be worn, and all facial piercings and glasses should be removed. If you have dentures, removable dental work, or are wearing hairpins, these should be removed as well. Due to the IV contrast that you will be given, you may be asked not to eat or drink a few hours before the exam. This will depend on the facility's protocol. If you do have a known allergy to iodine or the X-ray contrast, your doctor may prescribe a steroid for you to take at specific intervals before the test. This will reduce the risk of an allergic reaction. During the exam, you will need to put the responsibilities explained earlier into action. Most likely, the first thing to occur will be the technologist asking you your medical history. They may start the IV simultaneously. You will be lying on your back on the couch with your head closest to the scanner or donut-shaped hole. Once the IV is started, you will be hooked up to the X-ray contrast, and the technologist will position you in the machine using red laser lights. You will be moving in and out of the machine for a few scans, and then when the technologist is ready, they will let you know when they are going to begin the X-ray contrast. They will also let you know that the contrast will make you feel warm and like you have to go to the bathroom. But this is just a sensation and will go away shortly. Remember to hold very still throughout the whole examination. Once the technologist is finished, they will remove the IV and you can be on your way. After the exam, just be sure to drink plenty of fluids to flush the X-ray contrast through your body. Also, if you are diabetic and on metformin, the technologist should have given you a reminder to stop this medication for 48 hours after receiving the X-ray contrast. If you came in as an outpatient, usually results will be given to you in about 1 to 2 business days. The exam is analyzed by a radiologist, and he or she will send a signed report to your physician, who will then contact you with the results and any future actions. A variety of pathologies can be found and analyzed using a brain perfusion scan. The most common is an acute ischemic stroke. This type of stroke accounts for about 80% of all strokes. Ischemia means there is a deficiency of oxygen in vital tissues, which means blood is not going to certain areas in the brain, and its pathway may be blocked. Two types of ischemic stroke are thrombotic and embolic. A thrombotic stroke occurs when a clot that has formed due to arteriosclerosis blocks an artery to the brain. An embolic stroke happens when an artery in the brain is suddenly blocked by embolic material. This is usually a thrombus or blood clot that has developed elsewhere in the body. Brain perfusions can also be used if the patient has a known brain tumor. The scan evaluates the tumor's malignancy. It does this by measuring the blood volume going to the tumor. Usually there is increased blood volume supplying the brain tumor. Studies have shown that microvascular permeability increases with the increasing aggressiveness of tumors. Brain perfusion scans can also be used as a stress test for the brain. Patients with chronic cerebral ischemia related to underlying vascular stenosis are evaluated and their cerebral vascular reserve capacity is determined. CVRC describes how far cerebral perfusion can increase from a baseline value after undergoing stimulation. Stimulation is provided by the administration of a drug such as acetazolamide. After this is given, a second brain perfusion exam is performed. The quantitative results of a perfusion CT may be an advantage over single photon emission CT and perfusion-weighted MR imaging. Thanks for listening, and I hope you learned something from my presentation.